Hey YouTube, morning. I want to talk about my info session in this video. It was on February the 10th, and I'll go through it chronologically about what I experienced when I went there. You have to fill out some forms and then you go into a waiting room. There are about 30 people there. Only about 10 or 15 were patients, and the rest were companion people for moral support, and I went by myself, so I felt a little weird. We got to talking a bit, and I found out I'm the only person who was at that session who is in fact local. Most people came from at least an hour away. One couple came from a 4-hour plane ride away, and that is dedication. So then we went to the meeting room and had a slide presentation. We were talked to by a nurse, an internist, and a nutritionist, as well as a 18-month post-op patient with her daughter. The nutritionist talked to us first about what you can eat before and after, and it's funny because this guy got really upset when she said he couldn't have beer anymore, and that's for two reasons. One is the carbonation can bubble up. If you've ever experienced that, like in your esophagus, it can form into a big uncomfortable bubble. Well, that can happen in your stomach, and it can make it explode, I guess, rip it apart. And the second part is that you're not supposed to have alcohol after, and that's because people who have food addictions can bounce from addiction to addiction. So yeah, you'll be skinny, but you could be an alcoholic. So you really shouldn't be having alcohol after. And so this man was quite upset. And then about 5 minutes later, she talked about why some people, most people after, can't have sugary food, and that ice cream is one of the hardest things to digest. And he got up and walked out. No beer, no ice cream is not a life worth living for him. So, I mean, at least he knew his limits. That's one way to look at it. Then the nurse talked to us about what the procedure actually is, and some specific things that are unique to their clinic, which are if you're a smoker, you have to quit for at least 6 months before surgery, before they'll even talk to you. So you'll be like smoke free for a year and a half, really, before the surgery. And there's a specific reason for this because I've never been a smoker, so I don't know, but I assume when you breathe in smoke, some of it goes into your stomach, and the chances of getting an ulcer after surgery when you're a smoker are much greater. Maybe it's the thinning of blood, I don't know. I just know that it's dangerous, and my clinic has a no fatality record, so they want to keep that up. And one of the things they do is they refuse to have patients who disobey their requirements, which include smoking. They'll actually test you with a blood test if they think that you're lying about that, so it's pretty serious. Another thing is, she said, if you miss an appointment or you're very late and you don't have a very good reason, they will refuse you as a patient as well. Then the internist talked to us about having a psychological profile done to see if you're a good candidate mentally. And then the post-op patient, she talked to us. She was in her late 40s, and she didn't tell me anything I really didn't know. But it was good for other people there to see her daughter and have her daughter talk about what the family life has been like and what greater effects that you don't necessarily think about, what they'll be. And since I have experience with that with my mother, it really wasn't informative for me. But there was this one lady who was entertaining and aggravating, and she stopped this woman from talking and went on about how she was very disappointed that there was only one person there that she could talk to, and she wanted the clinic to make a panel of people at different times of post-opness. and have it in different cities so that she could talk to at least 12 people. And she wanted the clinic to arrange this just for her so she could interview them. And she said she was not even considering the surgery until the clinic did this for her. And the nurse said, well, we're not going to do that for you. We don't get paid for that. Do it yourself. And she was very upset. And it was aggravating and funny. And sometimes I feel like big people feel like they need to have big personalities to match. And why it didn't look good on her. She had no humble bone in her body. Anyway, the session ended. It took about 2 hours, 3 hours from when I arrived, and I arrived early. So when I was on my way out, I talked to the nutritionist and I said, in reference to the very annoying people who were there, and she was not the only one, that I was interested in knowing how many people actually got the surgery from those who originally requested. And she said about 40% drop out voluntarily. Another 40% are cut by the clinic because they don't think they'll be good candidates or they smoke or whatever. And about 20% finally do get the surgery. And the wait times are generally a year. And that's fairly low for clinics in Ontario, so that's why that couple came in from 4-hour flight away. Anyway, in my next video, I'll be talking about what they gave us at the meeting, because they gave us a big portfolio of lots of information, including their tips for getting surgery faster. And I imagine this could be done for all other clinics that you don't pay for, that you get under insurance. So wait for my next video for that, and I'll see you soon.